everyone. Good evening, good evening.
Thank you so much for joining us. I was just telling everyone how blessed we are to talk about a topic that has become almost a buzzword, you know, but we are all speaking among ourselves. And we thought the best way to kind of talk about this topic is to actually bring an expert, you know, somebody who actually kind of deals with this every day. So that we know whether we're saying the right things, the wrong things, should we watch the things that we kind of saying. And I was just telling everyone the house rules, which are, it's pretty much a platform for us to have a conversation. If they have any comments, any questions, to put them in the comment box. We will try to answer some. And some of them, if we can't, the doctor will refer you to places that maybe we can get the help to. So welcome to YzeUp.
Thank you. Thank you very much.
Awesome. So for everybody, I have to do this because we have to build that credibility in the beginning. Dr. Dimakatso, we're going to be speaking to her now. She holds a master's degree in psychology at the Afrikaans University. I remember it used to be called that. Rao, right? Rao.
There we go. I'm a Rauki.
Yeah, you're a Rauki. The doctor is a Rauki. I mean, I'm impressed by the majors in mathematics and psychology. And beyond the psychology, you've actually done some work in the areas of leadership development, coaching, personal development, and facilitation, and team development facilitation. Listen, I mean, I can go on like this, right? But I think right now we almost want to meet the human, the doctor. So if I had to ask, who is Dr. Dimakatso?
Dr. D, I think, is primarily a mother to a very special daughter who's also doubling up as my technical director tonight. And yeah, I'm a mom and I'm challenged by the parenting journey, and I'm also equally enriched by it. Yeah, and I'm passionate about people and aligning people to what I call the purpose of their life journey. And yeah, I started as a maths and science teacher. I didn't do it for very long. And then moved to the glitz and glamour of corporate. I wanted to wear high heels and makeup and big cars. And then really clinical psychology is my third career move. And it's, I think, for the first time I understood when people say, you know, yeah, you are trained and called. I think there are two types of people in any profession. I call the first group the trained, and then trained and called. Waiting, you just know this is what
I think
you
it's my signal on my side. Please just. I'm back. I think that's much better. I can hear you now.
Awesome. So yes, I was just saying yes. Yeah, for me it was a calling. You get two groups of people in any industry, in any sector. I said the first group is the trained, you know, and they you know, they also could do a good job. And then you get the trained and called, and those are people I believe they are wired to and graced to do what they need to do. And they kind of do it, slightly differently because this is what they were born to do. So I'm very blessed to go to a place I call my dream job every day.
Oh, wow. Oh, wow. So yeah, to your point, that life purpose, the thing that we are all trying to kind of, you know, reach in our journey, to figure ourselves out. You kind of already, you know, gotten there. So that's really, really amazing. So today is about dispelling the myths, right? Around this I'm calling it a buzz topic because we're all talking about it. I was laughing at work today, you know, it's become a thing, or mental health, or mental wellness, or mental fitness. You know, there's a whole lot of words that we use that kind of go with this thing. But I don't actually think many of us actually know what we're talking about, right? If we were to define this thing called mental health, what is it? What is mental health?
Look, I think if you look at psychology, so allow me to just teach for a little bit.
Yes.
If you were to look at the word psychology in English, psyche talks about the mind, you know. So when we talk about the psyche, we talk about the mind. If you look, as I said, I was trained by an Afrikaans University. So if you look at the word psychology in Afrikaans, it's sielkundige, which is the science of the soul. So as a psychologist, two areas that I work in is people's thoughts, which is the mind, and then people's souls. You know, those are the two areas that I work in. In the soul, really, what do we find? We find feelings. So when we say, how does it feel? We are asking you to reach into your soul and find out what the feeling is. In the soul, I also find we find the most precious resource. In fact, the highest power we have, the will to choose, you know, the agency to choose. So those are two things that sit in the soul. It's not everything. And then in the mind is our thoughts, it's also our beliefs, our conscious beliefs, our unconscious beliefs. So that's where also when we talk about mental health, we are actually looking at, are my thoughts and beliefs healthy? In other words, what do I mean health as a psychologist? I mean, do I have empowering thoughts that allows me to reach for my goals, that allows me to maintain 80 to 90% of happiness in my life, that allows me to be the best version of myself, whether be it as a mother, as an employee, as a sister, as a wife, as a boyfriend, girlfriend. So that's what we're talking about. That's what health is, because some of our beliefs trip us. You know, I see a lot of people who will tell me straight out, I know this is an abusive relationship. I know this is a toxic relationship. I know it. What keeps them there is not what they know or don't know. It's what they believe. If the belief, the unconscious belief is I am unlovable, chances are I'm going to stay with somebody who loves me sometimes and beat me up sometimes. Because what's the point? So that could be an example of a very limiting and disempowering belief that keeps me in a place where I can't be happy and I can't be myself, right? So in terms of soul health, we are looking at, do I make choices that increase my happiness level to 80% to 90%, or calmness level to 80, 90%? Or am I making choices that are informed by my values or my purpose? All right. So those are the two areas. And then if we look at psychiatry and professions like neurology, they are looking at the body. So, and then, if you look at priests and spiritual teachers, they are more looking at the spirit. So if we think of a human being, we can think of four parts really. A human being could be conceptualized as a spirit who possesses a mind and a soul and lives in a container called a physical body. So psychology looks at the mind and the soul, while psychiatry will then look at the body, which is the brain and the neurochemistry in the brain. And then, spiritual gurus like the imams and the rabbis and the priests will then look at the spiritual nourishment of an individual or spiritual health.
Wow. Okay. So here we are just talking about mental. And as you say, actually, the human being is composed of, different aspects to that. I mean, I am literally now going, oh, okay, that makes a lot of sense in terms of, the mind and the soul and how are the two actually working together. Well, if that's the case, then I'm going to say some of the myths that people are saying about mental health. And then what comes to mind when I actually say those lines, right? So some examples are mental health conditions are uncommon. How common are mental health conditions?
Look, I think if we think of the physical body,
Sure.
it's like saying physical conditions are uncommon. You know, a physical body will go through seasons where there's flu, there is cold, there's COVID. So the soul also gets, go through stuff when there's distress, emotional distress, or when there's trauma, or when it's an opportunity to grow. The soul will also have its own flus, its own cold, and so does the mind. So for me, yes, the soul goes through its own evolution and development, just like the body is subjected to certain conditions. The soul is also not immune, and the mind too. If you grow up in a home where you are told you're not good enough, you'll never amount to anything, of course, that may cripple how you think about yourself. And that may get you to internalize those kind of utterances, which means then you have a very negative self-image of yourself, making it difficult to relate with yourself. The first relationship we have is with ourselves. So if already I'm crippled by those kind of beliefs about, especially from significant others, we're talking about important people in our lives, our teachers, neighbors we looked up to, our moms, our dads, and whoever we looked up to, So I think, that's the same thing with the body. If you don't dress well, you can get a cold, if you eat. So when the mind is fed a strange diet, just like that when the body is fed a strange diet, it can get sick. So the same goes for the mind and the soul.
Wow. Laika is saying, love the comparison to flu. As you can see, I'm just like shaking my head right now. I'm going, wow.
Because, think about
it like that. Yeah.
We think about it, Judith. If we think of, even with, mental health conditions like depressive episodes, like bipolar, we talk of different severity. We can diagnose, major depression as mild, moderate, or severe. Wow. Just like all the other conditions, treated by any physical therapists.
Wow. Okay. Didn't know that either, right? Because I think we're all just saying we're depressed, but I did not know that there's a continuum to that. No, we're getting some nuggets today. I think to kind of debunk that myth, as you said, mental health is just like your physical health, right? So of course it's common. And it's funny that, as I said, it's become a buzzword now. We are talking about it as, mental health. Mental health is a pandemic. So it's almost like, if we look at the way we grew up, and I suppose I want to bring it back to Africanness, right? Why did we never know about this word?
I don't have all the answers, but I think one of them is, even in our languaging, arinayona, like words that describe mental health. What is I can't think of. I grew up in Soweto, Pimville, where I spoke Southern Sotho and Zulu. Although I started school when Soweto was on fire, so I attended a lot of boarding schools most of my time. So I know Northern Sotho is my first language, because Limpopo had to educate some of us. So I think the vocabulary it's not there. So ribuaka stress, we don't even, and stress and depression is not the same thing. Stress, I can still be sad, like a person who's depressed, but with stress, you send me a podcast or Kisheba, something funny. I don't know, Kanyimbao's roast was quite hilarious. I'm a fan, but yeah. So I can watch a comedy show and kind of recover from stress, or listen to a sermon and kind of, but with depression, the picture is slightly different because the soul is unwell, the mind is unwell, and the brain's chemistry has changed as a result of the emotional distress. So I think, one, we don't have a vocabulary. And I think, two, in the African healing system, we treat things very holistically. So, so I think we don't have, because if you go to if you look at how the healing was done in the African healing system, if you went to, you were depressed or you showed what symptoms of depression, you can't get out of bed, or even, something like a thought disorder like schizophrenia, you are sensing, you're feeling things, you're seeing things people can't see, you're hearing things. What the shaman will say to you is, let's dance. So already the dance, so because I think our healing system is so holistic and integrative, we don't treat the soul differently. So this is a very Western, even, Western outlook of health. In Western medicine, we treat the soul, separately from the body, but, and then the body separately from the spirit. There's this artificial, because it's very artificial, because, if I'm hurting, my body can keep that hurt and that bitterness, and I can get cancer. I'm not saying everybody who has cancer, is bitter or hurt, but I'm just saying sometimes they're so integrated. What happens in the mind and the soul can manifest physically, and vice versa. When I have pain in my physical body, it can make me irritable. It can make the soul. So I think in African healing system, in African cosmology, you will be asked to dance. And as you dance, of course, the serotonin, and the dopamine level are configured. So by the time the shaman says what is happening, the physical neurochemist is already taken care of. You've connected spiritually through the drum or whatever instrument, you've chanted. So you're already connected and you're anchored. So by the time we talk about it to the soul and mind issues, you've already done half the work. I look at how they treated infertility. Beautiful, beautiful. So yeah, I think those are some of the two main reasons. But also, I've heard people like, black doesn't crack. It's impossible for black women or a black man to get depressed or to get bipolar. I've had a mom who says, if you are telling me my 18-year-old daughter has got bipolar 2, bipolar type 2, she hasn't gone even through half the things I've gone through. How come I don't have depression? So, make your money nicely, sister, but don't come with labels.
Oh, wow. Oh, wow. And I think I'm almost like drop mic, because I think that is where the conversations go. We were having that discussion today to say it's almost like we're a generation apart, where generation A is you have to be strong. We don't have time for all of this crying and all of that stuff. It's, just get up and go. As you said, black don't crack. And it's a
at
thing
a
that
soul
passes
at a soul level, even at a psyche level.
So
it extends beyond our skin.
True. That's exactly it. And then we carry on that, right? We literally are just like, oh, well, we can't crack, then we must continue. And I love what you're saying. It's almost like what do you mean I have bipolar? You know what I mean? Why are you naming this thing? Because, we don't have such a thing. You know what I mean? You're now forcing me to think in that level, that there's a problem. And it's almost like a denial moment, right? Like to your point, because we can't crack. So this situation cannot happen right now. We need to almost fix it. And I think maybe that's the other thing is, one of the myths that I read about was you don't need therapy, just take a pill. So mental health, you don't need therapy, just take a pill and it will go away.
So here's the thing. If we look at a pill, that will be, in mental health, it will be prescribed by a psychiatrist, because I'm a clinical psychologist. I don't want to describe pill. I'm what is called commonly a talk doctor. My PhD makes me a talk doctor, you know, and so and their qualification makes them, you know, the doctors who give you injection and so forth. So if you have a mental health, often the two professions, we work very closely and more. I mean, so in a setting where I am at Akiso Randburg, you know, when I see a patient, it will be with a psychiatrist, you know, when we admit a patient, and there'll be a clinical psychologist. They may even be a dietitian, you know, if there's an eating disorder or there's overeating or there could be even an occupational therapist, you know, on the scene, or even a social worker. So we are a multidisciplinary team. So if we look at psychiatry and clinical psychology, I mean, if you come to a psychologist and a psychiatrist for the first interview, you know, the first consultation, we're going to ask you identical questions. The difficulty is what I try and explain to people is that although we are asking identical questions, we're not trying to irritate you. We are trained to actually listen very differently. Okay. A psychiatrist is listening for what is a struggle that the patient has that can respond to medication. So Judith is anxious. Okay, so she's gonna look, he or she, a psychiatrist, is gonna look at your medical history and then look at, okay, which medication can I prescribe? Okay, that won't, you know, kind of, interfere with whatever medical condition she has, or you know, bring dormant medical conditions to the fore. So the psychiatrist listens in a particular way. I listen as a clinical psychologist. Whatever the psychiatrist is targeting for treatment, I see that as a symptom. I'm kind of like, no one is born anxious. Why is Judith anxious? You know, in fact, when children are born, they're born quite bold. I find it quite bold. You know, you enter a world you've never been and you scream. You know, most of them, like, you announce your arrival. We would be very scared to enter a realm and tell everybody we're already here. So I would go, hold on, Judith is, you know, no one is really born anxious. What's happening with Judith? What has happened in her life? And two, I will also listen for difficulties that don't respond to medication. Judith's anxiety could be, it's about a boss at work. You know, I've seen patients who come Sunday, they really get anxious. You know, they hyperventilate, their chest is sore because of the tension in the relationship between me and a colleague or me and my line manager. So I kind of look at, okay, so what else could be underlying this, and what is this a symptom of? And as a clinical psychologist, I also listen for, where's Judith winning? While psychiatrists tend to listen for, what's the problem? I listen for, what's the difficulty? But where is Judith? Where's Judith winning? And maybe we can copy and paste and remind her of some of these victories, and maybe she remembers something about herself. So taking a pill takes care of the symptom. It doesn't look at the underlying root. So the pill could work, you know, for sleep or for anxiety. But if I don't revisit the trauma that caused the sleep, you know, in the sleep disorder or the insomnia, is a problem. I mean, some people that have not, you know, have got insomnia, and meaning they have difficulty sleeping. If you look at their history, you find that no, one of the parent was perhaps having alcoholism, you know, as a problem. And nobody slept until mom or dad came home. You know, so those people as teenagers, as adults, they then struggle to sleep because, you know, we had to wait for one of them, you know, before we could be safe to sleep. Because if dad or mom came home, those, you know, they'll first cause havoc. So we waited for, you know, whoever came back home until they slept, then we slept. So if you take a pill, unfortunately, you are doing one bit, you're taking care of one bit, you're taking care of the physical, but you're not dealing with the underlying trauma. You're likely to relapse because you can't expect medication to delete your traumatic experience or emotional distress or confidence problems. It's not possible.
Wow. We're treating the soul, we're treating the mind, we're treating everything. We're a holistic being. I mean, that's a whole lot of gems that you actually put there. And funny enough, one of the other myths kind of links back to what you're kind of saying as well about growing up and all of that. And I think this one I want to say is common. When we are having our chats, this is what we talk about. Mental illness is caused by personal weakness.
I think people with mental, I beg to differ completely. I think people who come and see a psychologist or a psychiatrist, a stranger, I think they are very bold. I think they're very courageous. To go to a stranger and say this and trust a stranger and open yourself and be vulnerable, you know, with a stranger and say, this is what my mom did, or this is what was hurtful, or this is a secret I've been carrying. I think it takes a lot of courage to look at my strengths, my wounds, areas of my life where I never grew up, you know, where I remain stagnant and perhaps I'm childish. I beg to differ. I think people who come and see any mental health practitioners are very bold to have a reflective space just to look at where my soul is unwell, where my mind is tripping me. I think it takes a lot of courage. I think it's also indicative of a lot of self-love and kindness to self. Actually, I say we come to therapy. We need to come to therapy not because there's a problem. I think we need to come to therapy to just invest in our mental well-being. You know, for me, when people come, I celebrate it because they are really doing their utmost best. And I think it can be one of the indicators of self-love and kindness to self. So I beg to differ.
Wow.
I think it is good. I think people who, I don't know if you saw that meme, it is people who need to be in therapy who often brings people who eventually see us. So I think if we were to use that language, then I'll say, actually, I think it's easier to stay out of therapy, and it takes a lot of boldness to be in therapy.
Oh, I love that. I absolutely love that. And as you said, it's just, there's a myth that you kind of just broke again, where therapy is seen as when you're sick, when you're ill, that's when you go to therapy. But as you said, actually, it's an investment in your well-being. I mean,
we understand financial well-being, isn't it? We understand that if retirement annuity, pension, provident fund, we understand we need to invest in our financial well-being because we are not always going to have the bodies that allow us to be active economically. So what's wrong with investing in my emotional well-being so that I can be the best version of myself? So that I can move towards reconnecting with my purpose or creating my life purpose so that I can make the best out of this journey. I find it weird that we understand that. You know, we wash every day, we cleanse our bodies every day. Why don't we cleanse the soul? For me, soul cleansing is when I go to bed and I forgive myself. You know, I before I go to bed, I recommend that people do some journaling, even if it's not on a daily basis. But one of my rituals is like, what did I do well? And, you know, and what could I have done differently? And what do I need to, to forgive myself for? That for me is soul cleansing. So why do we understand the concept of washing every day? You know, cleaning our bodies with water, moisturizing them, you know, even spraying a fragrance, and we won't do that for our soul. It's the same thing. It's really the same thing. You know, my thoughts, how do I guard my thoughts? I often like the idea of a quote. Some people will refer it as a mantra. I'll work with one quote. I think there was a moment where I was dealing with fear. So it depends what feeling is coming up for me. There was a moment where I was dealing with a lot of fear in my life. And I remember one of the things I directed or I allowed my mind to engage in my thoughts was courage is not the absence of fear. I think Marianne Williamson quoted, courage is not the absence of fear, but rather the judgment that something is more important than the fear. So those codes for me
Wow.
Help me to work through whatever I'm going through, whether it's fear, whether it's pain, whether it's shame. Because if you don't direct your thoughts to something like a quote or a piece of music, what your mind in default setting tends to do is to look back at your past. And I'm asked this when I get to heaven, because it doesn't look at the good part of the past. It looks at the painful parts. So, no, I think we work with our mind the way we work with our body. I think just because, the body, you can see I have a scratch and I'm bleeding, it doesn't mind that the mind doesn't bleed, and it doesn't mean the soul doesn't get bumps. And that's why we need to do rituals that just make sure we do soul care and we do mind care just as well as we do physical care, financial care.
Wow. I just feel like I could take your words and then put them on a billboard, because I think we have made mental illness as a thing, or mental well-being, as you said, a thing that shouldn't be discussed. It should be discussed behind closed doors. You know what I mean? It's not something that you tell people about. And maybe that's the next discussion that we need to have. So one of the young people mentioned that it's also now, as much as it's become a buzzword, we're also using it a lot in a sense that I have just been diagnosed with depression. You know what I mean? So it's almost like we're also, I don't want to call it normalized, because the normalizing is good because we're having the discussions. But it's almost like we're also getting defined by it. So you're saying psychology is mind as well as soul, right? But we are walking around saying these words. You know what I mean? That I have been diagnosed with this thing. This is who I am right now. It's, as you said, depression. I didn't even know I had different levels. It's a thing now. We're actually wearing it. We're talking about it. Is it a positive thing? Are we harming ourselves? Should we be on that tip?
Look, I am, it's a very powerful sentence because I am, and I get excited when I talk about things. My daughter's asking me to slow down because she can't.
Slow down, dog. Slow down for us.
I am, it's a very powerful statement because you are the only one that can say I am about you.
Amen. Wow.
And it speaks to identity. Often when I meet, individuals I work with, I don't always call them patients, although some are well enough to call, to be called patient. So when I work with people, one of the things I say is, okay, please introduce yourself. And I make the same mistake. And people will say, well, I think something you need to really know about me is that I'm HIV positive. And I'm like, excuse me, I am, all right. Is it I am HIV positive, or I am bipolar 1, or is it perhaps I am so-and-so who's been diagnosed with HIV positive? People who work with me knows that I've got a very light side. There's still a teacher, there's a very strict and firm, and, but there's also a very light side, like, really, just because a condition has got a name and a surname like HIV, you're going to change your identity to that. So I think we still need to remember, and I make the same mistake. I am a clinical psychologist. No, I'm not. I am who I am, and I practice clinical psychology, and it's one of the things I'm very passionate about. It's something I do. It's very important. But I am who I am. I am wisdom. I am love. When I say I am, I think we need to be thinking more about our spiritual identity. Those who believe in this, in the fact that a part of us is our spirit. And if you don't believe in spirituality, that's fine. I am can be, whatever it is. I'm justice. I'm truth. So I think when we say I am, we either need to be looking at our spiritual identity or really the essence of our soul, the real essence. So I prefer that we say I am so and so, and I have this condition, because in that way there is a person who can manage the condition. I'm not the condition. I often say, oh, really? You're going to claim monopoly over a condition? You don't have generalized anxiety disorder. you are not GAD, generalized anxiety. You are so who struggles with a generalized anxiety disorder. So let's rather manage it. And I often invite people, even when you think of a condition you've been diagnosed with, think of 3 symptoms that you want to manage so that it doesn't feel like you're experiencing the whole symptomatology, all the symptoms. So even when you say, I have a condition, I have ADHD or attention deficit and hyperactivity disorder, think about what are my 3 problematic symptoms that I need to manage and the 3 least problematic symptoms so that, we are targeting symptoms and it's manageable. So I think whatever you are diagnosed with, whether it's high blood pressure, low blood pressure for people like us, you're still a manager who needs to manage. So don't get wrapped up with identity of a conditions.
Wow. Wow. Sure. So, okay. How do we then recognize mental wellness? I think I loved your, there's a lot of comments here. Laika is loving the spiritual identity. She's loving the I am is a very powerful statement. I am the only one who can say that about myself. Absolutely. And she put a lot of fire on that one.
So be careful. So you need to think very carefully when you think I am. After that, then you need to think very carefully. I'm seeing a coach because part of what I'm investing in myself is I've been practicing as a psychologist for 16 years. I have my own psychologist.
Wow.
How else do I know?
Psychologists see psychologists.
How else do I know it works unless I do it, myself?
Wow. That is beautiful. It's not something you think about. That the doctor as well has got the mind and the soul. That needs to come in together.
I have blind spots. I have struggles. Wow. I'm far from, So I've lost my train of thought. Where was I going with this?
You're going with coaching and psychology.
Yes. So my coach, absolutely. One of the things I'm working with is my relationship with money, because we all do have a relationship with money. Some of us are very scared of money. So whenever we get it, we spend it as quickly as possible, very recklessly. Some of us are very scared of money. We hold it, and then we're stingy and we don't even get to it, right? So one of the things she says, I said to her, no, I can't say. She says, no, maybe you need to consider I am a good steward of money. And I'm like, but I'm not always. And she always says, then try I am learning to be a good steward of money. So I'm not for false confessions and false positive affirmation, because some of the positive affirmation may not hold the truth. So I even I am learning to be a faithful partner, or I'm learning to be a patient mom, or I'm learning, to be an employee that embraces excellence. So it's okay. Wow. It's learning in the continuous tense.
Wow, I think that is super empowering in the world, as you're saying, of positive affirmations, because I see them and we all get taught this I am statement. But to your point, we take it so far apart when we can actually just say, I am learning to be that thing. I'm not there yet. I'm on a growth path, I will get there eventually. I don't think we're taught that. Like as loving, I am learning to be a good steward of money. I think you've taught us a lot on that one. I think most of us are there, actually. But yes, I love that. Absolutely. There's a lot of heart on I am learning. And I think maybe, I think you've opened up the world for all of us to be able to be comfortable enough to say, I haven't quite reached that state yet. Yeah, I am learning to be where I actually need to be. And I think that's so important. And I like how you brought it back to work, to life, to motherhood, to relationships. There are statements that, I just need to get to, but I might not be there already, which I think is really a powerful statement. So how, if we're saying So you mentioned earlier that psychology is almost like your body, and with flu you can see the symptoms, right? When the physical is going through something, you're able to say my foot hurts, my head hurts, my stomach hurts. You know what I mean? You can actually locate the problem. How do we locate when you said the soul is hurt? How do we start realizing that I'm actually now hurt, and as per flu, I would need to go and see a doctor to help me with that?
I say, with the soul, which is where our feelings are housed, in the psychology that I'm trained in, I think two destinations or two emotions that indicates emotional health, and those are two emotional destinations that I'm trying to move my patients towards, is happy and calm.
Oh, wow.
I say to patients, emotional health, in my view, can also be described as anybody's emotionally is healthy or psychologically healthy or mentally healthy. If you are 80% happy, 80 to 90% happy in your life, shame, disappointment, anger must compete for that 10 to 20% in your life. Then you are well. The minute your happiness decreases beyond 80, I think you need to start, taking stock and looking at what is happening, what is taking the place of happiness. In my soul or in my heart. Some people believe, feelings live in the heart. So you need to look, is it sadness? Is it hopelessness? Is it helplessness? And then, so once you see a drop below 80 to 90%, I think 90 is a good place, so 9 out of 10 times I need to be happy, as I said, so that frustration and all of those emotions complete for that 10%. If you're not happy, that's still fine. If I'm 80 to 90% calm, then I think that's a sign of emotional health. So anytime you start feeling like my level of calmness is below 80, I think start looking at what is taking, if my calmness is dropping, what's coming in and what is it asking me to heal or to grow or to correct so that I can move back to the 80% calmness. So as a mom, you start shouting a lot, you are more irritable. So also another indicator, apart from those two, is, you start behaving very differently from how you behave. You're irritable, you don't want to leave your bed, you're just acting very differently, or you're spending way too much money when I'm a little bit on the stingy side. So any deviation from the behavior you consider the norm or the average, you need to also look at, your productivity at work. So those are things in our behavior and your thoughts. And that's why journaling becomes important, because if you keep a record of our thoughts, it's easy to see timelessly to say, hold on, last weekend I wrote a very sad poem. The past 3 weekends I'm writing very, very, poems around very unpleasant emotions. What's happening? I think it's very difficult when you don't keep a record as well. So I think those are some of the indicators. And then people around you, people you trust, obviously. I talk about, we always need to have a group of confidants. TD Jakes talks about confidants, constituents, and comrades. So you're confident. Also, be humble enough to listen to what are they saying. Friend, are you okay? If more than 2 people ask me, am I okay? Maybe, just maybe. I need to check in with myself or ask for clarity from them. What am I saying? No, you're frowning a lot. You've just been absent-minded, or you're not as talkative, or you're talking a lot. So I think also people around us could also be, could help us identify whether we are still okay.
Wow. So I think we use that word 80-20 rule as a thing. Business, We've watched way too much movies. They tell us about the 80-20 rule, Tyler Perry. I think we now need to start using the 80-20 rule to our own lives. I love how somebody has just said, what a powerful way of analyzing our emotions. Loving that. We've got a question. How do we help people who have expressed the struggle with mental health? What are the steps?
Look, I think one of the first things you can do is just, to encourage them and thank them, for trusting you with what they've told you, even if it's not everything. And as soon as you can connect them to somebody who can help them, our general practitioners are normally the people we see, mostly than, more often than other health practitioners. So, a GP will be a good place to start. But now we also have 24-hour counseling line, SADC, Lifeline, so also getting in touch with that if your GP is not, is not around. Casualty, especially if people are suicidal or homicidal, they feel like they're going to kill someone or they feel like killing someone. I think those are, point of contacts we can. So let's not try and make it better. Let's not try and give advice. Let's try and get them assessed by a professional where possible. Sometimes spiritual gurus also, the spiritual teachers also are helpful people to, to also, consult. So I think those are different places we can start. Social workers, if we have one in the community, nurses, are the backbone of this, health system. They see our patients longer than we see them, and they know a lot. So, I think those are spaces we can connect with as starting points.
Sure. Okay, I have 10 minutes with you. I think we could do this for 5 hours.
By the way, guilty as charged. The 80-20% is from my days in corporate, where we like, identify 20 smart things. I still believe in it. Identify 20 things that you find fulfilling and do it 80% of the time.
But it works. I really think it works. I think if, as you said, happy, calm, 80, 20, 90, 10, 70, 30, you know what I mean? As I said, it works as a framework to kind of be like, where actually am I? Yeah.
It has got me out of sticky situations, especially with people, with guys. I'm getting a lot of professional, African men who comes and say, I want to take a second wife. And I'm like, okay, tell me why, so that I understand. And they'll say, no, I love them 50-50. I said, not possible. So tell me who's the 80, who has 80%?
Yeah.
And, who's making up for the 20% of the other one. I mean, I'm being oversimplistic, but, that's also a starting point, that it's not possible. In nature, nothing appears like this as 50-50. It will be 55-45, 51-49. So the math works.
Wow. Okay, so listen, I'm literally after this. So everybody, if you're being shy about your questions, once this is actually done, it will be on our platform because it automatically does that. I think before I get to your closing points, how can people reach you? So they've heard you today. They now know their mind and soul, as you said. The physical is well, but the mind is not feeling well. The soul is not feeling well. You've kind of pointed us to other places that we could go to, from lifelines to, the hospitals, to our GPs, to our social worker, which I really think is helpful because I actually honestly didn't even know that. Where can they reach you?
I am based in Randbeck at Akiso Crescent Clinic. It's a private psychiatric hospital. We have about 4 wards. One is for, the Addiction Rehabilitation Center, where we admit people with, substance abuse problems or behavior addictions. We are all addicts, by the way. We all have an element of addiction. Mine is procrastination. It's not something. Wow. Yeah.
We are all addicts. All of us.
We all, yeah. So I think, and it humbles me, it reminds me it's a difficult journey. So yeah, there's a ward where we treat, adolescent and, who struggle with, mental health issues, but also mental health issues coupled with addiction. Substance abuse, it's a real problem. It's a big, big, big problem. And then we have an eating disorder ward. That's our third ward. And then we have a general adult psychiatry ward. So that's where I'm based. And I see, people admitted, mostly on medical aids. And then, although, private patients can be admitted who are not on medical aid. And then I see outpatients as well, people who don't need to be in hospital. So that's where I'm based, in Randburg.
Love it. Okay, you guys know now. You know what is it now? GPS. That's the GPS. And then I think I'll take this last question and then we can try to wrap up because the doctor is a very busy person. Are mental health issues permanent?
Depending what we mean by permanent. If we are talking about permanent being, are there mental health conditions where some people will need to take medication, for a lifetime? The answer is yes.
Okay.
But most conditions, guys, respond beautifully. Even those people who are taking medication for the rest of their lives, they can have very fulfilling lives if they see a psychologist and a psychiatrist. So there are certain mental health, as I said, the severity, there are people who need to be on medication for the rest of their lives. But I think in terms of psychotherapy, I don't believe in lifelong therapy. I'm winning, and therapy is successful if you come and you are living your life, not dependent on me week after week or month after month. So I think I have people who have gone through their healing journey and their growth journey. They only see me twice a year now, at the beginning of the year, to say, this is what I want to show up in the year. These are the qualities I want to, express, and this is my plan. And then they see me at the end of the year to say, tick this, tick that. What am I leaving behind? What am I? So I think we don't have to worry too much about dependency on the process. But yeah, there are conditions where people can stop their medications, but there are conditions that don't include.
Yeah. Okay. Well, I think that pretty much answers that question. Okay, Doc, we need to wrap it up. I think I'm going to end it with any tips. I mean, you've given us tips. The whole session has been about tips. But if you were to round it up and sum it up for everybody who's here, and thank you everyone for joining us today. What's your closing statement?
This was a statements. Look, I think there's a lot we can do to help ourselves. Mental health, is not the cheapest, of services or treatments. For most people, although it's important, I don't want to pretend that it's always easy to access financially. But I think there are things we can do to start to increase our mental wellness. I think we are not hopeless. We don't have to see a psychiatrist and a psychologist and everyone else to feel like we are doing something. I think I'm going to recommend books, that I feel if you never, if you feel like, I cannot afford therapy and I need some support, I have, I'm going to talk about books that I believe, these are 5 books that, will be good for your soul, soul health and your mind health.
We're all writing now. We're all writing. We're like, book.
And I so wish I could get commission. I don't even get commission on this. One of them is Finding Your Own North Star by Martha Beck, B-E-C-K. It's not her latest offering. Martha Beck used to be write the coaching section of Oprah magazine. I'm a big fan of Oprah. Okay. So that book, I would also suggest the 4 Agreements. This is now, Martha Beck in particular, if you have no idea of who you are, in terms of your identity, you at the end of the book, you'll have some good sense and clues. And you'll also, with Martha Beck, get a sense of what is my purpose on this life, what's my life mission and journey. And then the 4 Agreements, I can't remember the author now, but the 4 Agreements is quite popular. And then for parenting, I honestly would recommend the 5 Love Languages for Children, for those who are parenting teenagers, the 5 Love Languages for Teenagers. Gary Chapman is the author. He has simplified love and called it Love is a Language. If you can learn Ndebele, then you can learn Spanish. So your child could be speaking German and you are speaking isiZulu, and nobody feels loved and appreciated. And yet we all know intellectually that, of course, my mom loves me. So that would be one of them. And New Earth, I think I would also recommend that. And Zayn Mees has written a beautiful parenting book as well. Zayn Mees, the actor from, is it Seven Dilan? Yeah. Zayn Mees has done a fantastic job. I think psychologists, I don't know if we've been good at producing very helpful parenting books, but Zayn Mees did an amazing. All right, movies is also one platform. So that's the second thing in terms of what can I do to I think they're beautiful movies. I've just watched The Beautiful Mind again. So I think they're movies, Why Did We Get Married? Janet Jackson does an amazing job of representing psychology. What's the other one? Nana Elaya, Addiction. That lady, Nana, yeah. Who's that singer?
Not A Star Is it A Star Is Born?
A Star Is Born. A Star Is Born. I think in terms of that, A Star Is Born. Lady Gaga. How can I forget Gaga?
Yes.
Yeah. Sorry, I forgot Lady Gaga there. So yes, A Star Is Born. I think in terms of addiction journey, I think they are beautiful movies that we can watch and they can help us, work through. Music, thirdly, very, very powerful. Music is always going to take you to a feeling. All right. I used to have Monday blues until I realized my problem is I'm listening to the late Eddie Zondi on a Sunday.
Yes.
Okay.
Yes.
And then I get sad and I remember, this one reminds me of this one. And then I start WhatsApping them and they're like, sorry, I've moved on, girl. What's wrong? And then I'm heavy-hearted. So now, so music will always take you to your soul. With music, you're going to feel happy, sad, angry. So I use music therapy a lot because music is accessible. All right. So I think if you start your day with, let's say, jazz, I'm giving my age away, or classic music, I think it just allows you to, increase that level of peace in your soul and help you slow yourself down, start the day. So I think music, with angry teenagers, one of the first questions I ask is what type of music, and like they listen to rap and like, can we listen to the lyrics? And it's very angry. Like, are you surprised you're this angry? So how do you want to feel? Rather listen to the music. So those are some of the 4 things. And then just the quotation, I think get into the habit of just looking at, codes. And see what you can do. I mean, a friend of mine sent me this. This I'll say in closing. I think saying something like this, reciting something like this would also, and maybe some of you have gotten it already. This friend is, All right, she sent me this. So reciting something like this or repeating something like this.
Mm.
I release my parents from the feeling that they have failed me.
Mm.
I release my children from the need to make me proud so that they can ride their own ways according to their hearts.
Mm.
I release my partner from the obligation to make me feel complete. I think something like that,
Wow.
you know, depending whether you're working, you know, if you could say that to yourself. Yes, you'll say it with tears falling down your face. And then lastly, get into the habit of just, you know, 21 days of breaking a habit. So 21 days of doing one kind thing to yourself or others, or 21 days of learning to be appreciative. You know, so I think it's also helpful to those kind of rituals and practices if we do it on a consistent basis. Yeah, I think it will be good.
We'll be there. We'll get the 10% at least, you know, to the 90%, kind of moving
to the 80,
that way.
To the
80-20. Like yes. I said, that was beautiful. Please share it. You're gonna have to WhatsApp me that release that you've done, and then I'll post it on our pages after that. And then she also says, don't feel bad. She's very young and she loves jazz. So it's not an old thing. I've got the Reverend. Funny enough, my Reverend was in here and she just said that was amazing.
Oh, thank you. Thank you.
Listen,
Japanese jazz, by the way, guys.
Japanese jazz.
Oh, my word. Oh, my
wow.
word. Try it on a Sunday morning.
Okay. Okay. We've learned even more.
Gift from you to you. Japanese jazz.
Japanese jazz. Okay, now we know. Oh my goodness. So ladies and gents, thank you so much for joining us today. I'm impressed that the men also showed up. This was not just about women. I'm impressed by the age groups. I can see what's going on in here. The young, as they say, but I think it's also the different age groups. Doctor, I think today you have, honestly speaking, I think it's as I said, there's been so many myths, so many topical words and buzzwords that we are all using every day. Today you have honestly debunked a whole lot of that. We will be having this video on this platform. So if those people that missed it, please go ahead and watch it. I'll also load it on YouTube. I will load her details, as she said, in terms of where you can find her in Randburg. But I can honestly vouch for her. She is absolutely amazing. And she's been kind to us today.
I'm always kind. What do you mean I've been kind to you today?
Thank you so much. It was a healing experience.
Bless your heart. Thank you. Thank you for the opportunity. And I wish you love, all of you. I wish you kindness. I wish you gentleness of yourself. Take good care of yourself.
Oh, wow. Thank you so much, Doc. Have a good evening.
Thank you.